Meghan Butler.
Good afternoon, Senator Fonfara, Representative Horn, Ranking Members Fazio and Paletta, and members of the Finance, Revenue, and Bonding Committee. My name is Dr. Meghan Butler, and I serve as the Executive Director of the Connecticut Psychological Association, representing licensed psychologists across the state. I am here today to respectfully request that licensed psychologists be added to the professions included in the licensing fee reduction language in sections 14 to 28 of SB 84. As you heard earlier from my colleague, Connecticut has one of the highest annual renewal fees for psychologists, almost 5 times higher than our neighboring states. I want to briefly share with you a few stories from psychologists in Connecticut that illustrates how licensing fees affect the mental health workforce. One psychologist who wrote to us is one of the only bilingual Turkish-speaking providers in Connecticut. She accepts both Medicare and Medicaid, which means she intentionally chooses to prioritize access to care over higher reimbursement rates. She explained that the annual licensing fee becomes another financial burden layered on top of business costs. For clinicians serving vulnerable populations, those costs can make it harder to sustain their practices. We also heard from a pediatric neuropsychologist in the northeastern part of Connecticut who evaluates children with learning disabilities, attention deficit and hyperactivity disorder, and developmental conditions such as autism. She described how families in her region often wait months to find a specialized psychologist with availability. In many parts of the state, the need for specialized child mental health services far exceeds the number of providers available. The example we hear the most frequently comes from early career psychologists. Many of these clinicians train at institutions like Yale, UConn, and the VA here in Connecticut. But when they decide where to become licensed, often while still earning the trainee salaries, they compare licensing fees across states. And because Connecticut's fee is significantly higher than surrounding states, some choose to become licensed elsewhere. And with telehealth, these psychologists can live in Connecticut and practice remotely in other states in which they're licensed. So they live here in Connecticut, but they cannot serve Connecticut patients without a license here. And finally, some of our most experienced psychologists who have practiced for decades would like to gradually reduce to part-time work rather than retire completely. But when they weigh the cost of maintaining a license for a limited number of patients, some choose to retire altogether, meaning we lose decades of experience at a time when the demand for mental health care remains extraordinarily high. We appreciate the committee's leadership in addressing licensing fees for healthcare professionals and would welcome the opportunity to work with the committee to ensure psychologists are appropriately included in the provision. Thank you for your time and for your continued efforts to improve access to mental health care for the residents of Connecticut.
Thank you for your testimony.